Chronic myeloid leukemia is a blood cancer thought to arise from a genetic mutation.
When I first started treating and studying chronic myeloid leukemia in the 1990s, our experience was that the vast majority of patients would survive for 3 or 4 years, but then the disease would progress into an acute leukemia and the patients would in most cases die, so that by 5 years, only about 20% of patients were still alive.
Thanks to the work of Professor Tim Hughes and his colleagues, a lot has changed since then.
When we see a patient today with chronic myeloid leukemia, we can tell them that we have highly effective treatment and that their outcome, if they can take that treatment on a regular basis, is extremely good. So that today, over 80% of patients are alive and well, living with their leukemia after 10 years of therapy.
Professor Hughes helped create an accurate way to measure the amount of leukemia in a patient's system.
One of the critical ways to treat this disease most effectively is to know exactly what your current treatment is achieving in terms of, is it reducing the amount of leukemia in the bone marrow and the blood? Is it keeping it stable, or is it actually increasing?
Clinical trials he led in Adelaide developed a sensitive PCR technique that could answer those very questions. It became a potent tool for optimising therapy. So much so, around 30% of patients now enter treatment-free remission.
And we really pioneered this idea that we can go beyond just controlling this disease to the point where we can actually bring patients off therapy. We piloted a study in 2006 which demonstrated that some patients who achieve an excellent response can actually safely stop their therapy and the disease will not come back. And that's now become a globally applied therapy in chronic myeloid leukemia.
Professor Hughes leads the Precision Cancer Medicine Unit at the South Australian Health and Medical Research Institute and is a Fellow of the Australian Academy of Science.
One of the things I've really enjoyed over the last couple of decades has been to build a team of really excellent clinician scientists and scientists that are all working together, all having their own skills that can, in a combined way, make real impact in this disease.